Does anyone want to share how things are going in your programs?
Well,
Hi.
I'm going to call. Oh, go ahead.
Sorry, this is Alicia Martinez from King County, and I think I'm doing good, and I'm just here to say that I'm here to support you guys, and whatever you need, I'm here for you.
Great, thank you, Alicia. We have also Megan saying, Megan Jimenez from Early Head Start at Dennis Blue Education Center. They are continuing remote visits. We'll deliver first round of care packages to families tomorrow, so far as well as possible. Thank you, Megan.
Hey, Adrian, this is Ari.
Hi, Ari.
Hey, sorry, I do have a child in the background, which is, I'm going to try to make this quick, but we're also doing remote visits, some virtual, but mostly over the phone. And since we're such a small agency, we haven't really been able to deliver any goods to our clients, but we do have a resource list, and some of the resources I actually got from you guys. So our clients are, able to get stuff as needed. As far as now, anyways, we haven't had any issues, I don't think. So we're doing okay.
Great, thank you, Ari. What is important is to try to continue our services, and that's a lot for our families, just to be there.
Thank you.
Thank you.
Hi, this is Katie. I think we are doing fine. We're staying connected to our families, but we also are having trouble doing visits as usual, I would say. So lots of phone calls, lots of check-ins, some emergency support and resources. A couple things that we've done in the past week or so is we sent out a survey to all of our clients just asking how they're doing, what they're worried about. About half the respondents had experienced unemployment due to COVID. I mean, nothing shocking, but it's nice to have the information directly from our clients. And a huge number said they were experiencing spikes in anxiety and depression, which is something our home visitors were identifying too. So we're actually setting up a virtual training with the Mothers and Babies Intervention, which is designed to it has really amazing results actually for impacting depression, and then also increasing home visitors' confidence in working with families who are experiencing depression. So we're very excited to get that going in the next few weeks.
Great, thank you, Katie. If you can share some of that information to us, that will be great. I will be sharing tomorrow and this afternoon some resources that I got from some webinars that are in the same topic. I have also Jackie from the Colores. She says, we continue doing remotely home visits, delivering food, diapers, providing community resources to families as well. Thank you, Jackie. Alondra, the same. We're continuing doing home visits and maintaining phone communication with clients. Great, thank you. And then we have Mary with Friends of Youth. We continue to do remote visits, deliver resources. We order through SI Baby, Corner, thank you, and hold virtual group connections. Thank you. Does anyone else wants to give an update before we go to Lucy? Okay, so thank you very much for participating, and thank you for providing the services, and keep providing those services to each of our families. That I think is more important too. Lucy, I have you on. Lucy Bollinger will start her presentation about coronavirus and children.
Great. So I think I'm unmuted, and I think I turned on my video. So hopefully everybody can see and hear me. I just wanted to say, first of all, thank you to everybody who's listening. This is a super challenging time for everybody in the community, and I think, at least from what it sounds like just in these first few minutes, there's a lot of really important support being provided for kids and their families, which is really great to hear. I'm going to talk today just a brief overview about coronavirus and its effects in children and what we know so far, and then hopefully have time for questions, but feel free to, I'll try and monitor the chat on the side, and then also feel free to just interrupt and ask questions as we go along. So first I thought I would just start out with what is known so far about sort of how coronavirus medically is impacting children. We have not a whole lot of data on this. There's been a few sort of studies looking, a couple from China, and then one study that the CDC did that came out in the last week or so looking at cases in children so far in the US. But what it seems like is similar in both China and the United States is that the sort of good news for children is that it does seem like the impacts of coronavirus are generally milder in children as compared to adults. To give you an example of that, in this group that they looked at in China, 94% of children in the sample that they looked at were either completely asymptomatic or had mild or were moderately ill. That's compared to sort of 80% of adults who would fall into that category. 20% of adults would be sort of more severely or critically ill versus 6% of children. Coronavirus has similar symptoms in children, so fever, cough, shortness of breath, although shortness of breath is something that's a lot harder, I think, for children to explain or elicit, so that one is not as commonly reported. And then just sort of flu-like symptoms in general, body ache, sore throat, headache. Sometimes we also have seen some GI symptoms like vomiting and diarrhea. The difference is that the severity of the symptoms, again, seems to be less in children, such that, in half of cases, I think, in some of these studies, children haven't had a fever or haven't had a cough. So symptoms can be really, really mild, like just maybe a low temperature and a runny nose or something like that. In terms of kids needing to be admitted to the hospital, as you might expect with it generally being milder, we're not seeing nearly as many children being admitted to the hospital as we are adults. And then similarly, children are less likely to need ICU care and less likely to die from the coronavirus. In this study that the CDC did, which was basically just a sample of cases that had been reported to the state public health agencies, there were 3 pediatric deaths that had been reported as of April 2nd. But all 3 of those are actually undergoing sort of a review to confirm if coronavirus is the actual cause of death or not. So I think we still aren't entirely sure in those 3 cases. And then in China, there, in the couple series that I looked at, there have been a couple of deaths reported as well. There are, however, some groups of children who do seem to be at higher risk of having a more sort of moderate to severe illness. One group is babies, so infants less than 1 year of age. They are more likely to need to be admitted to the hospital, so definitely sicker than other kids. Overall, though, I think still infants less than 1 year are overall recovering, and many of them are recovering at home and not needing admission to the hospital. And I've still heard of cases in infants less than a year who have been essentially asymptomatic or very mildly symptomatic. And then the other group is similar to adults, children who have underlying medical conditions, and I think particularly things that affect the lungs, the heart, and then immunocompromised may also be at risk of more severe illness. I think we just have such small numbers at this point that we don't have really a great sense of how kids with underlying medical conditions do, but of children who have been sick enough to be admitted to an ICU, for example, they are more likely to have an underlying medical condition or be immunocompromised. I see a question on the side. Can you distinguish what mild, moderate, and severe? So for children, I would say that mild symptoms would not include, it says even mild symptoms could include pneumonia in adults. So I think that's actually a little bit different. In the study from China with the statistic of 94% being asymptomatic, mild, or moderate, the kids who were asymptomatic, they had a positive test but no symptoms, and then they had a chest x-ray which didn't show any signs of pneumonia or any effect from the virus. Similarly, kids with mild symptoms maybe had fever, cough, but their chest x-ray was normal. So they didn't think that they had anything really that was going on, like a pneumonia in their lungs. And then children who are moderately ill either had very mild symptoms, like they weren't really feeling that bad, but they actually did see some signs of pneumonia on a chest x-ray, or they had signs of pneumonia on a chest x-ray and their oxygen saturations were a little bit lower, like maybe they needed a little bit of oxygen, needed to be admitted to the hospital for monitoring. And then the severely and critically ill children are the ones that would be more like the adults that are getting admitted to ICUs who need a lot of respiratory support or who are having effects on organs other than their lungs, for example, or showing signs of damage to other organs. So that's a really good question. So I think for children, sort of asymptomatic, mild, and moderate would be less severe than what we think of in adults. For kids who are immunocompromised or have other underlying medical conditions, I think we just don't have the numbers to see how these kids are being affected. But I think certainly if I was looking at individual cases, I would be more cautious and want to monitor kids who have underlying medical conditions more closely because we just really don't know yet. So for the question about underlying issues such as asthma, that's a great question. I would think that kids with asthma might be at higher risk of having a more severe illness from the coronavirus, but there isn't any data yet out there. It's just too soon, I think. And since we haven't had as many cases identified in kids in general, we just don't really know. But certainly for asthma as a specific example, viruses can trigger an asthma, any virus, respiratory virus can trigger an asthma exacerbation in a child who has asthma. So I would be more worried that they might be more likely to have sort of an exacerbation of their asthma symptoms. In adults who have asthma, interestingly, I think that is not one of the sort of comorbid conditions that they're seeing in adults who are getting really, really sick and ending up in the ICU, but the effect might be different in kids. It's a good question.
Lucy, I have a question, and it's more about if the kid gets sick with COVID-19, how is it treated?
A great question. Actually, that sort of leads into the next slide, if you want to move to that, which is sort of about home care. If kids are sick, and then also if family members or caregivers are sick and have a child that they need to care for at home. So for children who have coronavirus, many of them, the good news is many of them, the vast majority of them are able to recover at home. And really what we do is provide kind of similar symptomatic treatment, just as you would for a kid who has the flu or sort of another respiratory viral infection. So the biggest things that I would think about is in sort of symptomatic treatment, Tylenol for fevers, or if they're just feeling really crummy or have body aches, pains, that kind of thing, to provide some symptomatic relief. And then another big thing is staying hydrated, so making sure that kids are taking frequent small sips. They don't have to guzzle drinks, but just frequent small sips and then monitoring urine output. So if a child is young enough to still be in diapers, they should be having at least 3 wet diapers a day, or about 1 every 8 hours. If it's less than that, then that would be a time when they should, families should call the doctor or potentially go to an urgent care if they're not able to get a hold of someone. And then essentially the other big thing is just monitoring for if things are getting worse. So for the case of coronavirus, that would be looking for if the child seems to be having sustained fast breathing, if they seem to be having difficulty breathing, or if they're just starting to seem kind of more lethargic, less alert, not as active as they were before. Those would all be reasons, again, to call the doctor or go to an urgent care or emergency department to be seen. But we don't really recommend, especially for young children. Teenagers is a little bit different, but I'd say for kids who are under, say, like 12 or under, I wouldn't necessarily recommend over-the-counter cough and cold treatments, but just doing Tylenol, potentially ibuprofen. I would start with Tylenol as a first line, and then kind of making sure they're staying hydrated and are breathing comfortably would be the biggest things for home care. Let's see. The question, can we address the common cold symptoms like runny and stuffy nose may warrant? So is the question sort of, could a runny or stuffy nose be coronavirus in a child? That's kind of what I'm interpreting from that. So I think in adults, we don't typically think of just a runny nose being, I would say that would be unlikely to be coronavirus in an adult. In a kid, I think it is possible. I still think there's so many other viruses, and then right now we're having allergies and other things going on, that if it's really just a runny nose, there's a lot of other things that could be going on. But I would make sure for everybody in the family to sort of perform good hand hygiene, wash hands, try and clean kind of high-touch surfaces. And again, try and stay away from people, like if you're worried the kid is sick, try and stay away from family members or other people that they might interact with, like older adults or adults with other medical conditions who might be at higher risk from catching coronavirus. Unfortunately, I think our testing is still limited enough at this time that these questions we have, if it's a runny nose or they had 1 day of fever, could it be the virus? I think it's possible. It's certainly very possible it would not be the virus, but our testing is unfortunately still quite limited, and so I don't think most of those kids would get tested if they were well enough to stay home. So I would still kind of provide the same symptomatic care at home for any sort of respiratory symptoms at all, if that makes sense. Other things just for care if a child is sick. So calling families, certainly I would call the pediatrician, reach out and see if they have any specific recommendations. They can also review most up-to-date guidelines on testing and decide if they think the child should be tested. A lot of pediatricians are doing phone or video visits, which can work really well if you have a sick child, not to have to bring them into the office. And that allows the pediatrician to at least get sort of, if it's by video, a look at the child and make sure that they think they're okay to continue care at home. And if not, then they'll often send them to an urgent care or emergency department, or potentially have them come into the office. And then sort of for preventing the spread of illness within the house, this is kind of all the same stuff that the CDC has been saying, but washing hands, if you think someone is sick in the home, washing hands really, really, really frequently. There is no like upper limit to how frequent you can do it, at least for 20 seconds and with soap and water. And then the other thing for adults is not touching your face, because that's how you sort of move these droplets from your hands to your face, and then that's how they get close to the sort of your mouth or your nose or your eyes where the virus can get in. For older children too, I would certainly have caregivers really reinforce frequent hand washing and not touching the face. Obviously for young children, you can't really avoid get them to stop touching things or stop touching their face, but you can still wash their hands, especially before and after eating or after they cough or blow their nose or that sort of thing. And then within the home, cleaning high-touch surfaces. So this would be things like light switches, doorknobs, countertops where food is prepared, and then the bathroom. There is some evidence that coronavirus can be shed in the sort of through stool. And so if there is someone sick at home, then I would definitely make sure to try and be cleaning the bathroom frequently as well. And then if possible, and all these things of course depend on what the living environment for each individual family is, separating a sick child from the rest of the family, that obviously for like an infant or a toddler is not possible. They have to have at least one caregiver who is going to be near them. But if it's a teenager or an older child, they might be able to hang out mostly in one room and just have the caregiver kind of interacting with them, and while you're trying to keep other kids in the house away. Older children, like over 2 years of age, can wear a cloth face covering. Again, for that 3 to 5 year old age, it's really hard to get them to keep something like that on. But the idea of a cloth mask is that it keeps the sick person, again, from getting their sort of droplets that they breathe out or cough out or sneeze out into the rest of the room. And so if everybody in the family is sick, that's not as important, but if there's one person who's sick and they can wear a mask, it may help protect the rest of the family. And then if possible, sort of having this sick individual have use their own dishes or clean their dishes before other people use them, towels and bedding, that sort of thing. It's okay to wash materials like clothing or laundry that the sick person used with regular laundry if you're doing it in like a washer or dryer, because that everything will be killed in the wash and dry cycle. I would just say be careful putting the laundry in, so wash hands sort of before and after touching any dirty laundry. And then again, if possible, a lot of people live in places where everybody shares a bathroom, and so this is not practical. But if possible, to have the sick person use a separate bathroom, then that can sort of help keep the rest of the family a little bit more separate from them. And then of course, like a infant or a toddler, that doesn't work either. So a lot of the CDC recommendations, they don't work as well, especially when you're caring for a young kid. But I think the biggest thing is just really frequent hand washing. And then if you're an adult caregiver caring for a sick child, really trying to remember not to touch your face, because that will help sort of prevent those droplets from ending up near all of your mucous membranes. And then the other side of this slide, I just kind of put, if the caregiver is sick, so if a parent or whoever's taking care of the child has the coronavirus, and they're obviously trying not to pass it along to their child, a lot of the same concepts apply in terms of sort of trying to be separate in the household. Again, if it's a single caregiver for a child, then that's not going to work. If there's two caregivers, then the one who is well, or if they're both sick, the one who is not as sick could sort of be the primary caregiver for the child. And then if possible, again, just trying to be separate and use separate dishes, etc. But I recognize that's not an actual possible situation for a lot of families. So again, I think just washing hands really frequently if a caregiver is sick. And then that caregiver could also wear a mask. And again, the idea would be to try and protect the rest of the family from getting the respiratory droplets when they cough or sneeze or that sort of thing. And then the other thing just to think about, since not that wants to think about this, but to be prepared ahead of time, since we are seeing even sort of adults who are 30, 40, 50 getting severely ill from this, is that if they, if it's two caregivers or if it's one caregiver, thinking of like a backup plan just in case they get sick enough that they get admitted to the hospital. Can you identify another caregiver who could step in, knowing that that child might have been exposed to the coronavirus? So if possible, you wouldn't choose a grandparent, maybe you would choose an aunt or an uncle who is healthy, or that sort of thing. So trying to plan ahead of time, for the worst, and hopefully that won't happen. Many adults are able to recover at home, and many do care for kids while they're sick, but just in case, sort of planning for that. If you want to go to the next slide, I think I just have kind of one more, and then we'll open it up for general questions. So this is just not so much related to coronavirus specifically, but just when should kids go to the doctor right now for other things like well child visits, other urgent care type visits, when everybody's trying to stay home and trying to avoid exposure to other people who might potentially be sick. So this one is definitely it's going to be very clinic specific. So I would certainly have parents call their child's provider to see what their clinic specific policies are. However, there are a few things that I think many, probably not all, but many pediatric offices are doing somewhat similarly. So first of all, many have sort of rapidly scaled up their telemedicine practices, either by phone or by video. So if a family has capability for a phone or potentially a video visit, they may be able to do things over the phone or video, like medication follow-ups for things like depression, anxiety, ADHD, that sort of thing. They may be able to do some urgent or sick visits also over the phone or video, or at least use it as kind of a triage. Does this need to come into the office, or can we address it at home and kind of watch and wait and see how things go? For well child visits, I think there's a lot of variability in what practices are doing, but many of them are still offering in-person well child or preventative care visits for newborns up to about age 2 years. Some of them are going to be more like 15 to 18 months. The goal of that is for newborns who ideally are seen in person at least a couple times in the month after birth, so they can get their newborn screening done and make sure that their weight is going okay, feeding is going okay, all of that kind of stuff. And then the older infant visits are for getting in this sort of primary vaccine series, which goes to about 15 to 18 months. So a lot of practices really still want to be getting kids immunized so that we don't, in 6 months from now, have a measles outbreak or something like that. And so I think if I would still encourage families to go in for those visits if their child is getting kind of that primary vaccine series up to about 18 months to 2 years. And then for older well child visits, a lot of those are being pushed off until they can be done in person at a later date. However, if a parent had a specific thing that they really wanted, they were planning on having their visit in, end of April, and they had a specific thing they really wanted to talk about, I would call the office and see if maybe they could at least have a phone or video focus visit on that one question, and then have their well child visit for later, hopefully later in the year. And then the other big category is sort of behavioral health. A lot of these visits, I think, can be done at least over phone for things like medication checks. And then a lot of therapists are doing phone and video visits, although I think that is some variation about what insurance people have and who the particular therapist is. But it's certainly something I would call and check in on, because I think it's really important for these issues to be addressed in a time like this when we're seeing potentially spikes in depression and anxiety from all the changes in routine from what is normal for everybody. And I think that's kind of the last prepared slide I had. There's a couple on resources that we could show now or at the end, depending on if people have more questions or not. I'm happy to answer. And if I don't know the answer, I'll try and write it down and get back to you.
You just have one here. For newborn, should family members wear masks when caring for the baby?
So that is a really great question. I think certainly yes, if a family member thinks that they might be ill or potentially exposed to the coronavirus at all, then I would say definitely yes. If it's a family that is well, they don't think they've had a specific exposure, I think it's a little bit up to them. I don't think there can be any harm come from wearing like a cloth mask when taking care of the baby. And it could certainly help if, say, it's like a very mild or an asymptomatic infection that the caregiver has. So I don't think it's a bad idea to wear a mask, but I don't think if the family is mostly at home and they're doing social distancing from other people and they're not going out very often and they're staying in the home, I don't think they necessarily have to wear a mask all the time, or it can be a little bit of a more of a personal decision for them. And then similarly, when caring for a newborn, just like people probably would do, even if we didn't have this going on, but lots and lots of hand washing, especially before kind of touching and holding the baby.
Talking about that, Lucy, we got a question about if it is safe to deliver the baby in a hospital with all the situation.
Yeah, that's a really great question. So I think I would still I would say yes, it is safe. I think most labor and delivery wards are have changed a lot of their normal protocols to make sure that they're keeping the staff safe, the mom safe, and the baby safe while they're in the hospital. And certainly if someone has questions about that or is concerned, they could call and sort of ask the hospital about what they've done. Many hospitals are actually testing, I think they're doing this for sure at UW, and I'm not sure if they're doing it at other places, but they're testing all moms before they are admitting them. And if they're positive, then that means they can take this sort of adequate preparation in terms of having the correct protective equipment and keeping that mom isolated from everybody else who's there. So I think, yes, it is still safe to have the baby in the hospital. And then you have the other resources available if there happens to be any complications during the birthing process.
Lucy, you have a question about from Claudia. It says, I'm understanding correctly, well child visits for up to 2 years are recommended be kept, but over 2 years they should be postponed to a later date.
So so it depends on the office, but I think that is correct as a general rule of thumb. So I would certainly have a family call and see what their specific kind of policies are, because some offices may be pushing like a 2-year-old visit off, but they'll see an 18-month-old, for example, and some may be seeing some kids who are older, but generally I think most offices are doing well checks for sort of infants and toddlers, but then they will be pushing off well visits for older kids.
Great, thank you.
Moms, yeah, so it's true. They're not. There's a lot of variability, which is. I wish we had a little bit more consistency across our different hospitals. Yeah. But I think it's still safe to give birth in the hospital. But I think it's certainly warranted to call their obstetric provider and ask what they're doing and if there's anything that can be done to help maximize safety for mom and baby.
So I have a question. It's just a follow-up for your, if a mom is pregnant, it's gonna deliver and then she tests positive for coronavirus. Does it cause any problems to the mom or to the new baby? Did you? Mm-hmm.
So that's a great question. So I think we still don't have a lot of data about coronavirus in newborns. And then we also don't have a lot of data about if the mom is infected while she is pregnant. Could there be any negative outcomes sort of developmentally or during the birthing process for the baby? I think what we see so far is that pregnant women appear to be at a similar risk in terms of getting infected with the coronavirus to non-pregnant adults. But given sort of changes in the body during pregnancy, in the immune system, and other sort of changes that go on, they may be at higher risk of a more severe infection. That's kind of theoretical right now, but for example, with influenza, pregnant women are certainly at risk of a more severe illness than an otherwise healthy adult who's not pregnant. So I think it certainly could be true. The same is true for coronavirus. Right now, there's no evidence that I think there is, for example, things like an increased risk of birth defects for a mom who was infected with coronavirus in pregnancy, but it's too early on for us to really be able to analyze all the data, and so that may change as we get further out from this. For a pregnant or for a mom who is positive and then has her baby, there's also no evidence right now that coronavirus can sort of go through the placenta and infect the baby that way. There are some newborns who have tested positive shortly after being born, but I think we don't know yet if that infection was from in utero or if it was just from sort of the close contact with the mom during the birthing process or after the birth. I think if a mom has coronavirus and is caring for a newborn, doing as much to sort of prevent the respiratory droplets from getting near the baby is the best thing to do. So again, lots and lots of hand washing, wearing a cloth mask or some sort of covering on the face, especially while feeding or breastfeeding the baby. And then some hospitals, I think many hospitals will actually separate a coronavirus positive mom and the newborn, and will have the newborn in a separate room. I think that's kind of a challenging thing to do because there's a lot of, while there is risk to the baby from getting the coronavirus, and we know that an infant may be at higher risk of having a more severe illness with coronavirus, there's also a lot of harm in separating a newborn from the mom. And so I think that needs to be weighed really carefully. And I think that the family and the parents, I think it's a reasonable area to have sort of a discussion and shared decision making with the family about the risks and the benefits of separating or not separating. If a mom is caring for a newborn infant at home, then I think, again, I would just hand washing before and after feeding. If the mom is pumping, making sure to clean the pump and any part of the pump that touches breast milk before or after each feed. And then if there are two caregivers, the primary caregiver until the mom is well again could do most of the sort of hands-on infant care. But again, I think that has to be balanced with the risks of harm from not having this sort of infant maternal bonding.
Thank you, Lucy. Does anyone have another question, doubts? We have some time still. I have, if no one have another question, you know that when the whole pandemic started, one of the recommendations was that if you were pregnant, it was better for you to completely stay away of the whole situation. Do we have any evidence that a mom or a pregnant woman has more chance to get COVID-19?
That's a really good question. So I think right now we think that their chance of getting infected is about the same as another adult. But since we don't know if they get infected, are they more likely to have a more severe illness? And we don't know the answer to that. I think right now they may not have a more severe illness, but since, for example, other viruses like the flu do cause more severe illness in pregnant women, I would definitely be cautious and try and avoid exposures as much as possible.
Thank you. Any other question? You could type it, you can say it aloud. I think we can go to the resources.
Perfect.
Perfect.
So there's just a few slides here. There's tons of stuff online, but just to highlight a couple of things. This is the CDC website. So they have a lot of information about if you are sick, what to do, and then also if you are caring for someone in the house who's sick, what to do. So that's where a lot of the recommendations about sort of social distancing within the household, frequent cleaning, all that kind of stuff comes from if you're looking for those things to pass along to families. They also have a page about caring for children, and they talk about a lot more than just if the child is ill, but also sort of what to do with kids who are now at home all the time instead of being in school, how to talk to them about coronavirus, some tips for that. So just a lot of general information. And then on the next page, there's a couple resources from American Academy of Pediatrics. The first one is their main page on coronavirus with information for families. They do have, I think, a number of articles that are translated into Spanish as well. I don't think they have a lot of other languages, unfortunately, at this point. But there's a lot on there about, again, not just if the child is sick, but about what to do in terms of school, daily routines, how to talk to them about coronavirus. And then the second link is specifically for children with special healthcare needs. There's a few things I think to highlight there. One is that a lot of times kids with special healthcare needs may have medical supplies. And so I would definitely, if you are interacting with families where that's the case, try and make sure that they are looking at their inventory and trying to be proactive about getting things ahead of time. Because I think it's harder to find, especially things like gloves or masks, which families may use. And then for kids who need special formulas, that's another thing that's been a little bit of an issue. And so trying to make sure families are trying to get that earlier rather than later. If families are running into issues with special formulas, I would definitely call their pediatrician. They potentially may have samples or may have ways to help get them that if they need it. And then the other thing, I think on that page, they have some resources just to reach out in terms of reaching out to schools for kids who may have an IEP or have therapies like PT and OT that they get at school, those sorts of things. It's a lot to think about. Huge change in routines for very complicated and complex routines, even just on a regular basis. So,
thank you, Lucy. Also, we have shared some resources on our Basecamp, for example, with kids with autism. If you needed, those are there. But thank you very much, Lucy. The last one that we have, and thank you, Victoria, for this, is the guidance that we send to everyone on what to do when you or your child gets sick. So we receive all the new guidance translated on Vietnamese, Ukrainian, Spanish, Somali, Russian, Chinese, Arabic, Chinese traditional, Arabic, and Amharic. You have the link here. It is in our Basecamp. And I will be sending this presentation after this webinar, also with the recording too. And then we're almost at the end. We have about 5 minutes. If you have any other question, more than welcome. Claudia, this is exactly where I tell my families to get information, CDC, WHO, and pediatrics. It is important to get science-based, reliable sources versus all the misinformation that is out there. That's correct.
Yeah, it's so true.
Thank you, Claudia.
And if anybody comes up with questions later, I'm happy for Adrian to pass them along to me, or he has my email address if you want to reach out. And if I don't have the answer, I can certainly try and get in touch with someone who does.
Thank you very much, Lucy, for that. So thank you for the great information. Thank you very much, Lucy. Thank you. I would like to share this with my team. Where can I find? I will be sending it to everyone in the in this call, and also will be in the base camp for BSK. Kinder is providing virtual early intervention therapies, PT, speech, OT, and development evaluation. Thank you for that, Aileen. Great, thank you. Thank you so much. Well, I think that's all. If you don't have any other question, please share with us any information in Swahili and French. Or okay, perfect. Well, we'll try to do it. Great. Well, thank you very much, Lucy, for participating today. We really appreciate the time that you invest in this, and we will send any question that we have. Thank you, everyone, for participating today. Thank you, Lucy.
Thank you. All right.